Due to the COVID-19 pandemic, universities in New Brunswick moved from traditional classroom to online delivery. This shift was quick and for students largely unexpected. University students were forced to finish course requirements using unfamiliar platforms and as such reported increased academic pressure. Given the strict social distancing guidelines have a negative impact on psychological health, students who are isolated from both their social and their academic supports could experience even greater stress and anxiety. The purpose of this study was to examine the effects of COVID-19 pandemic on the physical and psychological wellness of university students. Further, we will briefly discuss students' concerns about their academic success and how it affected their overall wellness. In this online questionnaire study, 879 participants completed measures to assess their physical well-being, subjective well-being, and their personality traits. Data was collected in 2018, 2019, and in 2020. And in 2020, after the University of New Brunswick announced that the remainder of the winter term would be virtual, 120 participants completed a modified questionnaire package that included questions about their stress associated with the pandemic. Students reported higher satisfaction with how the university handled the initial response to COVID-19, but in spite of this, they were concerned about how their instructors would manage their courses and this impact on their ability to succeed. Overall, student impact was significantly correlated with the personality trait of conscientiousness and with neuroticism, and also with the RAND energy subscales, emotional well-being subscales, and social functioning subscales, as well as overall life satisfaction. We created two groups using the March 13th university closure as a cutoff date and compared RAND 36 scores. Participants who completed the questionnaire package prior to their university closure had higher RAND energy and RAND emotional well-being subscale scores. Further, using a 100-point sliding scale, the participants rated their perception of risk and consequences of COVID-19. Participants rated their personal risk as lower, with slightly higher risk for their family and even higher risk for the general population. Correlations between risk perception and measures of physical health indicated that COVID-19 worries were significantly negatively correlated with the RAND physical and general health subscales. Interestingly, COVID-19 worry was not associated with specific personality factors. These results highlight the significance of COVID-19 pandemic on both physical and psychological health. Although strict lockdowns that were enforced during the early stages of the pandemic were necessary, public health and government officials should take care to ensure that when possible, the psychological effects are considered in planning future responses.